Thanks for tuning in today for this quick update on some soon-to-be released changes to our routine antenatal shared care pathway. My name is Sandra Fitzgerald. I'm a pharmacist and one of the clinical editors with Hunter New England Community Health Pathways. I'm here today with Jo Wood, who's a GP and another one of our GP clinical editors with the Pathways team. We're going to be looking at the pathway today on the draft site, which you'll notice is pink and very different to the blue colour of the live site. And the reason we're looking at the draft site is we want to give you a sneak preview of what the changes are, because this is one of our most utilised pathways, Jo, and we just want to orient everyone to what it's going to look like and what the changes are and how they're going to find information they used to find. So Jo, why the change?
Thanks, Sandra. Yes, one of our most utilised pathways and also probably one of our best examples of collaboration. We've had over the years lots of contributions from various subject matter experts. We've had fantastic input from GPs who deliver antenatal care in the community, obstetricians, midwives, infectious disease specialists, sexual health physicians, experts in drug and alcohol, mental health, Aboriginal and Torres Strait Islander health and multicultural health. So lots of different brains sort of working on it to contribute, and that's why it's made a really good example of how our whole health community has worked together to try and improve outcomes for families, for mums and for babies. And basically, in a nutshell, we had a lot of content that had outgrown the format that we have been using.
Well, let's have a look. Let's compare the old format and the new format and get people used to the new pathway.
Fabulous.
So Jo, can you talk us through the old pathway and the new pathway and let us know what's changed?
Yeah, sure. So the trick has been moving from the schedule of care we originally described in the table. It was quite handy for scanning depending on gestation. Over time, the pathway has moved to a true model of shared care. And even though the pathway has been moving with the changes over the years, it has become a bit tricky to put it into a simple list. So early pregnancy care is a good example. There are many things that need to be covered in that phase of a pregnancy, and it tends to happen over several visits. It's also that step in pregnancy that any GP needs to know how to approach thoroughly, even if we're not going to go on and provide shared care. So we had that all in one block, and it was getting a bit tricky to find the detail we needed. So we've moved over to hopefully what is a really familiar format to our Health Pathways users. And now we have each of the visits tucked into wide drop boxes there, and you can navigate quickly to where you need to go.
So Jo, can you give us an example of how you'd use this pathway in a consultation?
Yep. So one example might be that I have a woman present in early pregnancy and I'm arranging initial bloods, and she mentions that her mum has diabetes, and I want to check and see if this is an indication for doing early testing for gestational diabetes. So I could check on the pathway by going over to the early pregnancy drop box, going to that investigation section and just checking if one of those risk factors for diabetes is listed there. Another might be that I'm seeing a patient at 22 weeks and I want to give them their second trimester blood test form, but I just want to double check that I've got everything. So I go over to the 22-week visit, go to those second trimester blood test lists there and just check and see, make sure that I've got them all ordered. Another thing might be that I have a pregnant woman who doesn't have any particular risk factors for fetal growth restriction or for stillbirth, but I just want to use this pathway to help prompt me to make sure that I've covered those 5 elements to reduce the risk of stillbirth. So Sandra, can I ask you a question now?
Certainly.
So say if I had one particular thing like syphilis and I just wanted to know when I was supposed to be testing for that during pregnancy, but I don't want to go through all of those drop boxes. Is there an easy way to search?
Funny you should ask, Jo, there sure is. Up in the top right-hand corner, there's a plus sign. So if that's not already opened, open that up, and over there you'll see that there's an expand all button. Click on that. That will open up every drop-down box in the pathway. You can then press Control F and put syphilis in, and that will bring up every iteration of syphilis in the pathway, and you just scroll down till you find the one that you're looking for. If you're not in the pathway yet, you can go to the search bar at the top of the page and just type syphilis in, and that will bring up every pathway that has syphilis in it, and you can scroll down and find the one you want, and there is routine antenatal care. So you find the pathway you're looking for, you click on that, go to the plus sign, open that up, expand all, and you'll find syphilis there. So on your screen now, you'll see the login details for the draft and the live site. We're not sure when this pathway is going live, so if you go and have a look and it's not there, hop onto the draft site. Please let us know what you think. In the bottom right-hand corner of every page, you'll see a send feedback button, and we'd love to hear your thoughts. And thanks for tuning in.
Thanks, Sandra.